Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and today we're answering this question: what is thyroid optimization? I've had a few questions from listeners to my material who are asking, what does it mean to optimize their thyroid, right? They hear a lot of people talking about optimization. You got to optimize your thyroid. You got to optimize your sex hormone. You got to get to optimization land. What the heck does that even mean? Well, I think it really is dependent on who you're talking to, okay? And when we think about healthcare, when we think about medicine, there's really three big categories that people fit into, right? So we have the medical model, and their job is to identify disease, disorders, and conditions that require some type of medical intervention like drugs or surgery. And when they identify diseases, try and manage those conditions to help people have a more comfortable life as they progress through their life, okay? Then we have integrative medicine, which is essentially the blend of allopathic medicine, which primarily focuses on disease management, detection, and drugs and surgery, and functional medicine and what functional medicine should be. So what is functional medicine? Functional medicine is really focused on identifying the causes of dysfunction and disease and trying to address those causes to restore health with diet, nutrition, lifestyle, and some strategic supplemental strategies. That's functional medicine. So integrative medicine really uses a blend of potentially drugs and functional medicine strategies to try and restore health or manage conditions. So if you go to an integrative practitioner who does hormone work, they may use T4, they may use T3, they may use some dietary and supplemental recommendations as well to try and manage the condition. From a functional medicine perspective, this is my thought process from a functional medicine is this: that functional medicine is really a whole body approach to identifying, reducing, and eliminating the cumulative factors that initiate and sustain what we call a cell danger response. So we typically operate in one of two modes. We're either in low stress homeostatic regulation, where essentially we make all the energy we need to do everything the body needs. We feel good, we function good, primarily in that model. The other regulatory mechanism is an allostatic regulatory response, where we have excessive stress on the physiology and we don't make enough energy to do everything we need to do. And what happens is the body needs to downregulate some systems, some aspects of our physiology to shift energy to defend the physiology. If we don't have enough resources to do everything we need to do, something gets downregulated, okay? And so that's allostatic regulation. So when we in functional medicine, when somebody comes to us for a functional medicine approach, a true functional medicine approach, what we need to do is identify, reduce, and eliminate the cumulative factors that can initiate this cell stress, cell danger response. One of the things we need to do almost out of the gate is to determine, is our current patient a person who's regulating from more of a homeostatic standpoint or an allostatic standpoint? If they're in a homeostatic standpoint, then we can talk about this idea of how do I optimize the person. But if the person's in allostatic, they're in allostatic regulation and they're more of a fight or flight response, the strategies that we might use in homeostasis aren't going to work for the person in allostasis. And I think that's the biggest misconception for people in functional medicine who are actually practicing from an integrative approach versus the person who's in functional medicine who's really practicing functional medicine, okay? So the rest of this definition, so whole body approach to identifying, reducing, eliminating cumulative factors that initiate and sustain a cell danger response, and allostatic regulation because it's the sustained cell danger response and this allostatic regulation that results in what we call allostatic overload, that results in signs, your symptoms, your dysfunction, your disease, and death. And so this is a different model than medicine. It's a different model than integrative. What functional medicine should not be, and unfortunately has become this, it is not the artificial manipulation of signs and symptoms with drugs or natural supplements or natural hormones or bioidentical hormones. There's a lot of people in the sphere who say they're functional medicine practitioners, but really don't practice functional medicine based on the principles of functional medicine. What they're trying to do is manipulate T4 values or T3 values or both, or they're trying to manipulate what your estrogen, your testosterone, and your other hormones are, and they call that optimization. If you were in homeostasis and you just lost the ability to make hormones or to convert T4 to T3, then I could understand the optimization, like giving you more T3 would make sense. But most of us have never lost the ability to convert T4 to T3. There are a small population of people who have a reduced conversion of T4 to T3 based on genetics, but the rest of the population has the ability to convert T4 to T3 appropriately when they're in homeostatic regulation. The problem is the vast majority of people showing up in an endocrinologist's office, an integrative practitioner's office, or a functional medicine practitioner's office aren't in homeostasis. So the reduced conversion of T4 to T3 is often not broken physiology, but part of this allostatic adaptive response. And forcing more T4 into the system or forcing more T3 into the system to manipulate a TSH, a T4, a T3, a reverse T3 doesn't restore normal physiology, doesn't restore homeostasis. It's not truly optimization. That's called manipulation. So when somebody says, we'll just keep trying to optimize your sex hormones with medication, but never really truly addressing the root issues, they're not a person who's doing optimization, they're a person who's doing manipulation. And so I guess the best analogy would be if somebody walked into a medical doctor's office with high blood pressure, high cholesterol, that medical physician's probably going to put them on blood pressure medication and a statin. And the person in integrative medicine may say, well, that's crazy. Why wouldn't they use natural products to lower the blood pressure and to lower the cholesterol? They've got all kinds of supplements to do that. And I understand both sides, but the medical physician is doing what their job is. They're trying to support the dysfunction they see to make to reduce the risk on the person. The integrative practitioner is looking at that and saying, man, we shouldn't use these drugs, but maybe we're going to use a combination of drugs and supplements. But what a functional medicine practitioner would do in that situation is they would look at we would start to ask, why is blood pressure elevated in the first place? And then two, what's resulting in elevated cholesterol levels? Not manipulate it into range, but ask, why is the body not able to utilize the cholesterol or eliminate the cholesterol? It's a different approach. So when we think about thyroid optimization, if you go to a medical physician, an endocrinologist, they're probably going to try and manipulate or optimize TSH with T4 only. To ask them to do anything else is going to probably create frustration for the clinician and for you, because their job is to optimize or manipulate TSH into range. For an integrative practitioner, they may be trying to manipulate TSH, T4, T3, reverse T3 with bioidentical hormones, glandular products, whatever combination of things they want to use, T3, T4, T4, T3, glandulars, whatever, and they're trying to manipulate TSH, T4, T3 into a certain range. That's a different model. But if you go to a true functional medicine practitioner, they're going to want you to have the least amount of thyroid hormone needed and then help identify reduce or eliminate the stressors that are resulting in the reduced conversion of T4 to T3, the increased conversion of T4 to reverse T3, the thyroiditis that may be going on, or restoring iodine support to the gland so it can function again. The functional medicine approach is not about manipulating lab values into range with meds or drugs. The functional medicine approach should be identifying the factors that are causing the body to shift from homeostasis to allostasis. And when we identify those things, reduce them or eliminate them, then we can support the recovery from thyroid allostasis, from overall body allostasis back to homeostasis. And that's when people heal, that's when people repair, that's when people lose weight, that's when their signs and symptoms improve. And that's when the thyroid gland can make more thyroid hormone, there's less thyroiditis, and there's better conversion of T4 to T3. And you see T4, T3, TSH, reverse T3 come into more optimal ranges, not because of manipulation, but because we've actually restored normal homeostatic regulation. If you have any questions, put them below this video. Thanks.